Hi, my name is Delilah Silva, and this is my presentation on exercise testing and prescription. I hope you like it. So Chapter 1 kind of gives us an understanding of what physical activity and exercise is. And for that chapter, I'm going to be talking about the general risks associated with physical activity and exercise. So there are 3 common risks that are associated with this type of exercise. The first one being the risk for cardiac death. Despite the known benefits of physical activity and exercise, inherent risk does exist. For individuals that are younger than the age of 30, it is most commonly seen in cardiac death, but it is also known as congenital or inherent abnormalities. High school and college athletes are typically required to get a pre-participation screening. This is because to provide safety and to let them know of any conditions that they may or may not know of. So the rates of sudden cardiac death and acute MI are disproportionately higher in least active individuals performing infrequent exercise. So for example, adult who has not performed any exercise, doesn't really work out, is shoveling large pounds of snow. That can cause an injury. The second common risk factor is the risk of cardiac events during exercise testing. So an EPC is required to be there during any tests that are conducted, and this should provide safety. Overall, the risk of cardiac events during symptom-limited exercise testing in a clinical environment is low. There should also be proper screening and testing done, and most tests can be performed with a high degree of safety. The third and final condition is the musculoskeletal injury associated with exercise. So typically the highest risk is associated with activities that are weight-bearing or involve repetitive movement, such as running, cycling, weightlifting, jogging. Those are all some exercises that are associated with them. So the most common musculoskeletal injuries occur in your lower body, so around your knee or your foot, in those regions, anywhere below your abdomen, that's where it occurs. So although it's not life-threatening, musculoskeletal injuries still present an issue. Preventing and minimizing injury will lead to greater opportunities to remain physically active. And to minimize musculoskeletal injury from happening, the EPC should consider some circumstances, such as the risk, the low intensity that they're going at. They should be able to provide realistic goals for exercise. So in Chapter 2, it talks about the pre-participation physical activity screening guidelines, which we all know is very important amongst exercise. So for my topic, I'm going to be talking about the importance of physical activity screening. So in order for us to reduce the likelihood of unwanted events or any type of injuries, it is recommended that you go through the pre-participation screening in order to prevent these situations from happening. So pre-participation screening involves gathering and analyzing demographic and health-related information on a client with some health and medical assessments in order for us to determine if they have any signs or symptoms and the extent at which they can go in their future. The pre-participation physical activity screening is a dynamic process that varies, as mentioned, according to any diseases that they may have, whether it's a metabolic disease, a cardiovascular disease, any signs or symptoms that they may have, such as constant pain in the chest, and the duration that they want to do in exercise. So If they want to work out for 3 months, they want to work out for 6 months. We also have to consider that as well in order to determine how much they can really go. So the following is a list of reasons why it's important to screen clients first before they participate in any physical activity programs, such as, do they have any medical issues that you should know about? Do they receive any medical attention? They need to get a clearance in order to perform the physical activities, and whether or not they should be supervised. So if someone's walking or running on a treadmill that goes through these signs or symptoms or any other conditions, do they need to be supervised while they're doing this activity? In Chapter 3, it talks about the cardiorespiratory fitness and assessments for exercise programming for healthy individuals. So for my topic, I'm going to be talking about adenosine triphosphate production, which is also known as ATP. ATP is made up of carbon, hydrogen, nitrogen, oxygen, as well as many other phosphorus groups. ATP is very important because it helps produce energy throughout our body. It is also very crucial amongst muscle contraction. So what this means is our cells are continuously having to produce ATP at the same rate that it's being used through 3 metabolic systems. These systems are known as creatine phosphate, anaerobic glycolysis, and the oxidative system. So creatine phosphate is the most immediate pathway. And what happens is CP donates phosphorus group to ADP and in return creates an ATP. So this pathway is used during intense exercise that is less than 10 seconds. So it doesn't go over 10 seconds. So for example, this would be throwing a frisbee or shooting a basketball. So those are just some examples of what creatine phosphate is. Next, we have the anaerobic glycolysis. So what happens in this system is glycogen gets transformed into pyruvate, gets converted to pyruvate, and this metabolic pathway is used for intense exercise that is no more than 90 seconds. So for example, running a 100-meter dash or a 200-meter dash would be some examples. And for the last one, which is the oxidative system, in this pathway, you need oxygen. That's why it's called oxidative system. So you need oxygen in order to help produce ATP, and this happens in the mitochondria, which is also known as the powerhouse of the cell. And for the oxidative systems, you have 2 metabolic pathways. We have the Krebs cycle and we have the electron transport chain that kind of go hand in hand with each other. This pathway is also used for moderate intensity exercises of 1 to 2 minutes. So for example, going for a run or a jog, and long distance, it'll go on from there. In Chapter 4, it talks about the muscular strength and muscular endurance assessments and exercise programming for apparently healthy participants. So for my topic, I'm going to be talking about the different types of resistance training. So the different types of resistance training are proven to be effective in enhancing muscular fitness. There are 3 different types of common resistance training. The first one being the dynamic constant external training. So this is the type of training in which the weight that you use stays constant. In other words, it stays the same. It does not change in the lifting and the lowering of the weight. So a good example of this exercise, an exercise that you could do, would be the power clean and snatch weightlifting exercise, which goes really good with the dynamic. So the second resistance training would be the isokinetic training. So this is a type of training that's more focused on the dynamic muscular actions that are performed at an angular constant velocity. It also requires specialized equipment to be used that is designed to train only single limb movements, single joint movements, and the speed of movement is more focused on this form of training rather than the resistance. So we always look more on the speed than we do at the resistance for the isokinetic training. The last and final type of training is the plyometric training. So this refers to specialized method of conditioning that's designed to enhance neuromuscular performance. So what's focused on this type of training is the quick and powerful movements that involve a rapid stretch of the muscle, and then immediately after are followed by a rapid shortening of the muscle. So a type of exercise that could be used for this training would be like a depth jump or a plyo box jump. So that type of exercise could be used in the plyometric training. So in chapter 5, it talks about flexibility assessments and exercise programming for apparently healthy individuals. So for my topic, I'm going to be talking about the modes of flexibility. So there are 4 different types of modes of flexibility training modes. So the first one being static, then we have ballistic, we also have proprioceptive neuromuscular facilitation, also known as PNF. And those 3 are considered traditional modes of training, while the last one we have is dynamic. And that one is still coming to the surface. It's still being commonly used amongst training modes. So of all different modes, static flexibility training is commonly utilized and can be further subdivided into 3 categories. So we have slow and constant stretch with a partner. We have slow and constant stretch without any assistance, just by yourself. And we have slow and constant stretch against a stationary object, such as like a wall. Several studies have demonstrated that static stretching can lead to both short and long-term flexibility through a decrease in muscle tendon stiffness and viscoelastic stretch relaxation. So static is the most commonly used type of training mode. A lot of athletes do use it and they find it most effective. So the second one, as I mentioned, is ballistic flexibility. So for this stretching, it involves rapid bounce-like movements in which the resultant momentum of the body or body segments is used to extend the affected joint through the full range of motion. So given the nature of this movement, this type of stretching produces a rapid and high degree of tension inside the muscle, which may potentially lead to injury. So it was it was recommended to use ballistic flexibility, especially in athletes that are a part of basketball. They found it effective, but they did take into consideration that you could also potentially cause damage from these stretches. So a lot of people do not use it anymore. Next, we have the proprioceptive neuromuscular facilitation, which I mentioned is PNF. It's a collection of stretching techniques combining passive stretch with isometric and concentric muscle actions designed to use the autogenic and reciprocal inhibition responses of the Golgi tendon organ. So PNF stretching was first developed not only as a stretching technique, but also a strengthening technique through a series of diagonal patterns to help many physical therapists treat their patients with neuromuscular paralysis. And then they later adopted the use for it by athletes to increase the range of motion. So there are 3 types of stretching techniques. We have the hold and relax. We have the hold and relax with the antagonist contraction, and we have just the antagonist contraction. So each technique comprises 3 different phases. So we have the passive pre-stretch, passive stretch, and we have contractions. So the 4th and final flexibility is known as dynamic flexibility. It's, as opposed to the previously mentioned techniques that I said, dynamic flexibility uses slow and controlled sport-specific movements that are designed to increase core temperature and enhance activity-related flexibility and balance. In chapter 6, this chapter talks about the functional movement assessments and exercise programming and healthy individuals. So for my topic, I'm going to be talking about self-myofascial release and stretching. So something very important to know is how to manage hypertonic muscles and soft tissue restrictions that can compromise mobility in the muscle and even in your performance. According to recent studies and investigations, they have shown that SMR elicits improvements in range of motion, also known as ROM or ROM, without performance decrements when they are prior to any activity. SMR is based on a form of manual therapy that is believed to release the discomfort associated with tender spots within the myofascia, which are also known as trigger points. So SMR involves the compression of soft tissues using tools such as foam, rollers, tennis balls, roller massages, and it's better to perform it as the individual yourself than with any therapist. Speaking from personal experience, for example, when you get shin splints when you're running or your calves tend to hurt, it's best to roll them out with a roller, which is something I have done, and it has brought a lot of relief to my muscle, and I do feel better after I do it. So this is something that you can do at home or anywhere that you can find these tools in order to do this. For chapter 7, I'm going to be focusing on weight management. So although there are a lot of factors that contribute to an individual's body weight, a healthy diet and regular physical activity is critical for maintaining weight loss. Personally, as someone that is lazy and really does not like to work out a lot, it's really hard for us to lose weight, especially during these certain conditions in quarantine. It's made it a lot harder for everyone to work out and eat right. So for weight loss goals, we have to develop realistic weight goals in order to point out the path that we're going on. So for example, we can't say, oh, I want to lose weight in 100 pounds in a month. That's not realistic. That's something that's going to be really hard for you to do. But if you say, I want to lose 10 pounds in the next 2 weeks, it's realistic. We can do that. It also depends on your body and your metabolism and how your body functions. So a safe and effective weight loss should occur at 1 to 2 pounds per week. But like I said, it depends on your body, so whether or not you can lose more, it depends on you. Measuring body weight each week is a good method in order to determine how much you've lost and how much you've progressed. Another factor is also energy balance. So how much energy you're intaking, the amount of calories that you're consuming, and your energy expenditure, so the amount of calories that are expended. To reduce body fat, energy expenditure must exceed energy intake, which is referred to as the negative energy. So you have to be releasing the amount of energy that you intake. So in the final chapter of this presentation, also known as chapter 12, it talks about facilitating health behavior change. So for my topic, I'm going to be talking about understanding the client's behavior. So self-regulation is a process of monitoring and changing one's behavior when normalcy is interrupted. So normal for many people is being inactive, having a poor diet, having stress, and poor sleep, which is also my lifestyle. So this lifestyle is habitual, automatic, and comfortable. Normal is having a sedentary job and day-to-day routine that tends to all other priorities instead of giving your time and attention to physical activity and exercise. When this normalcy is interrupted, such as with a medical diagnosis and exercise prescription, many individuals initiate a process of trying to monitor and change behavior to align with their new lifestyle goals. However, many do not have the self-regulatory abilities to successfully carry out these changes in your behavior. thus at a risk for falling back to where they became comfortable to, such as normalcy. So like an example for me would be if I work out every day and I keep the routine going, I can go for a little while, but if something interrupts my routine, so if I work out at 1 o'clock every day, I work out 1 o'clock, and something happens at 1 o'clock and something interrupts my routine, then the next day or that day I'm not gonna do what I need to do, and then it's gonna start going downhill from there, and I'm not gonna want to work out the next day, or I'm gonna be like, okay, like I didn't work out yesterday, let me take a rest. So it's hard to keep a routine going. This is the end of my presentation, and I hope you liked it and enjoyed. Thank you.